Hello and welcome to The Society with Fatma Shaheen at PTV World. Floods, as we all understand, have a glaring social impact. Some are those which we see short term, other are those which actually, span over time. What kind of social impacts can be expected to arise post this flooding that we've recently witnessed in Pakistan? This is something that we'll be talking about during the course of today's show. We'll more particularly be talking about the outbreak of waterborne diseases in the flood-hit areas. We'll also be talking about the psychological trauma of those who have been victims of the floods. In this regard, a very important part of today's conversation will also be geared towards ensuring that, children who have been deprived of their right to education, they are given that right. How particularly will floods in that regard be affecting this right? We'll also be talking about the increase in the gender-based violence cases as they are coming forward. And last but not the least, an issue which is often ignored that we will be touching during the course of today's conversation will be the destruction of cultural heritage, more so because of this flooding. This and much more to follow on today's show. We'll also be talking about the very pressing need of community engagement, more specifically local community engagement when it comes to mitigating the negative social impacts of flooding that we are experiencing and which we are expected to experience in the upcoming days and of course months. This and much more to follow on today's show, and to do that, let me introduce you to my today's panel. My first panelist for the show today is Alia Aftab, who is a psychologist. Assalamu alaikum ji, and welcome to the show.
Thank you.
My second panelist for the show today is Yameen Hassan, who is an environmentalist and she's also an analyst. Assalamu alaikum ji, and welcome to the show.
Thank you so much.
And via telephone line, I'm joined by Dr. Sobia Qazi, who is the Professor of Infectious Diseases, Institute of Public Health, Visiting Faculty, Services Hospital, Lahore. Assalamu alaikum, Dr. Saiba, and welcome to the show.
Walaikum salam, thank you.
You're most welcome. To get the conversation started with you, Ali, I think at a very basic level, we need to talk about, all those intangible, all those indirect kind of impacts that, of course, not only those who've been directly hit by the floods are going to actually face, but also the society at large, because we do understand that, of course, this is going to translate on the whole nation. So when we talk about the most pressing social impacts, as a psychologist, what do you feel is the most pressing problem that might come up in the coming days, or for that matter coming months?
You see, the most important thing is these people who have been hit by floods have been displaced from their home. And home is their cultural heritage, like you spoke earlier. It's about their environment even. They're used to it, especially the children, because they play. The women, they are lactating mothers, they are pregnant women over there. So basically they feel a lot of distress. So when we talk about distress, it's uneasiness, to be simplified forms.
Right.
And uneasiness can be mental uneasiness, it can be physical, it can be emotional, because it's a combination.
Of course.
It's a combination.
I think right now the focus is a lot on the physical ailments.
Yes.
The focus is directly on the issues that we see, of course, to be arising every day as things are happening and every day as things are coming in front of us.
You see,
but
physical,
I think the long-term impact should be on the psychological, aspect
That's
as well.
where I'm
Something
coming
which
to.
I feel at least is not getting that much momentum now.
You see, we always talk about the physical aspect and we ignore the mental. We need to be very precise, and we need to know that physical and mental health are interrelated with each other.
Of course. Both of them come within the domain of health.
Yes, we don't talk about the mental health, we ignore it totally. Because you say mental health, oh my God, everybody goes through stress. But look at those people, we are sitting at our own house. But look at those people who have lost their homes,
Right.
who have lost their crops, their lands. Some people might have some animals, cattle.
I think it's just not about financial losses, as we all understand. It's also, I think, the loss of losing people that you love, the
Your
trauma
loved
that you
ones.
suffer. And I think this is something that will stay with us. I'll come to you, but before that, I think, Yamin, we must talk to you about, the very important need to have a gender interventional kind of an approach. And some of the things that Alia pinpointed on, which I would like you to deliberate further, is the fact that, when we talk about all these issues, we cannot ignore the fact that, whenever such disasters, whenever such calamities hit any nation, women, unfortunately girls, unfortunately being the more marginalized section of that society, are the hardest hit. So when it comes to devising solutions, why is it so important that we need to have a gender response approach?
It's like the women that suffer the most during the natural catastrophes, because in a largely patriarchal society like Pakistan, there's not a realization about the needs and sort of demands that women require in these times. And if we link it with the legal aspect, so in times of such calamities, there's an absence of law, and in that state of anarchy, women are subjected to male aggression and male power, such as you see gender-based violence. There is a need for basically women from the political elite and the organizations to actually come forward and raise awareness that okay, these are an important sector of the society and they require attention, and you need to give them adequate responses that are different from those of men. They have needs that need to be acknowledged and that need to be addressed.
And I think these needs, of course, on that note, include healthcare needs, on which I'll come to you, Dr. Sobia. I think we must also talk about the recent outbreak that we have seen, and of course, which is expected to rise when it comes to, of course, the transmission and the influx of waterborne diseases. So, as an expert on this subject, how do you feel can we, control the transmission? How do you feel can we control the spread, considering, of course, that, they aren't ideal circumstances out there?
First of all, I completely agree with our psychologist that mental and physical health go hand in hand. And both of them are interlinked with each other. So mental health is a very, very big issue. Unfortunately, the physical aspect of things are also equally important. And waterborne illnesses are a problem which happen. First of all, we need to realize that this is climate change. And because of climate change, we've had, all of these rainfalls, and because of this, we've had floods. So primarily, it's not the usual riverine floods which have happened. And this is something that we need to get used to. This is something which is going to become the norm. So I think it's very important that healthcare providers get braced for this, because this is going to happen every now and then. As far as the waterborne diseases are concerned, the first thing is that the water in this situation becomes stagnant. And wherever you have stagnant water, it provides a hub for all kinds of infections. If water is moving, the chances of getting waterborne diseases are relatively less.
Of course.
Then this water gets contaminated by human waste, by animal waste, and that provides a nidus for all these infections. Right. So there is a long list of infections which can happen. For example, cholera and typhoid are the big ones. And unfortunately, because of the very, very extreme summer that we had, and the summer which started early, cholera was already on the rise in various parts of Pakistan, even before the floods happened.
Right.
So it's going to potentially worsen a condition which is already existing in the country.
Madam, in this regard, I would also want to, draw your attention towards dengue, because, every year we do see that dengue does come. It is on a rampant rise. And, recently we've also seen a large number of cases being reported in Karachi, a large number of cases being reported in Lahore per se. But, these are the places which are not directly impacted by, of course, this catastrophic floods. So do you at some level, as, of course, an expert on infectious diseases, see a correlation somewhere?
Right. So first of all, we've got to realize something, that dengue is a consequence of climate change. It's a consequence of urbanization. And I think the floods may or may not increase the cases of dengue in rural areas, but we know it for a fact that malaria is going to be the bigger catastrophe.
Right.
We have to realize that malaria is the big disease, because malaria occurs in swamps and marshes and dirty water, and in the presence of animals. So as far as flood affected areas are concerned, we first have to think about malaria. As far as dengue is concerned, yes, of course, whenever we're going to have more rainfall, there is going to be more dengue. And we know that last year, for example, in Lahore, there was in areas of Punjab, there was a huge dengue outbreak, which had nothing to do with the floods.
Right, madam, your point is noted, on which I'll come to you, Ali. I think we must also talk about, of course, the challenges which we may face. What do you feel are the most pressing challenges? Because at least when I look at it from an objective bystander viewpoint, I see that, there could possibly be a dearth of, doctors out there. And then, of course, we do see that we are running short of medicines. Even in cities like Lahore, so to speak, of course, we have a shortage of Panadol. So how can we, then expect that all these medicines, all the right healthcare supplies, they will reach the people, that too timely?
I would say that we need to be raising some awareness, and apart from awareness, we need to do efforts to reach there and to supply them also, because if they don't get all these things, it will create more mental distress.
Right.
And when it creates more mental distress, their physical health will also be affected. And PTSD we talk about, post-traumatic stress disorder,
Right.
which is very common among flood victims. They will have flashes of, because right now it's still too early to talk about it. They are just coping up with all the things.
So as a psychologist, madam, do you feel that all these anxiety related issues, all these PTSD kind of issues, they crop up more in the rehabilitation stage? Because like you very rightly so mentioned, now is it too early to talk about this?
Start talking about it, because you see, we keep it inside and it becomes bottled up.
Right.
Because we feel alone. So we need to talk about it. We need to, like, there are other people even. And right now there are loads of people who are helping and reaching out to them even. But right now they need to talk about it. Be one. When they are one, they need to talk about, they will know that there are other people also with them who have suffered.
Right. And I think, madam, in this regard, the media has a very pivotal role to play, on which I'll come. But madam, I'll come to you, Dr. Sobhi. I think your narrative on this, of course, as a doctor in your right, is also very important. When we talk about, you know, addressing all these medical issues of those who have been hit by such diseases, at the end of the day, of course, having the right infrastructure, having the right access to such people is very important. Now, considering that, of course, you know, the floods have had a very devastating effect on the infrastructure of the country, making it, of course, difficult for people to actually reach such people so as to give them, you know, aid physically. How then do you feel can this problem be tackled?
We need to realize, unfortunately, that a lot of the areas which have been affected by the flood were rural areas where healthcare systems were very creaky to begin with, unfortunately. And this has already added to, you know, a system which wasn't very robust. I think for this, as everybody says, that I think we need to come together, the local governments, the provincial governments, the NGOs, the national government, international NGOs, everybody needs to come together and work.
Right.
And I think everybody needs to pitch in, because all the work is ultimately done at the local levels.
Right.
So while the local governments and the local, you know, BHUs and DHQs and doctors will send in their healthcare providers, but I think the provinces and the NGOs, the international NGOs, everybody needs to help, and people are doing it.
That's very rightly put by yourself, madam. But I also think that it's just not that, you know, you need to come together. There needs to be proper coordination in this regard as well, so that, you know, all those efforts, they don't go in vain at the end of the day. On which I'll come to you, Yamin. I think we must also talk about a very important social, you know, impact, so to speak. I think demographic as well, because it would fall in that category too. Now, a lot of times you understand the fact as an environmentalist that when such disasters do happen, people tend to migrate from one place to the other. Even otherwise, we have seen in Pakistan, this has been a common occurrence. So the question then is that when we talk about climate induced migration, when we talk about, of course, leaving behind your cultural heritage, how can these issues be solved? Because I think climate change per se would, by that definition, have a very strong impact on perhaps maybe, you know, leaving behind your culture, leaving behind your ancestral homes, and that in itself for a lot of people would be traumatic too.
Exactly. I think culture is a very important element of expression. So when you leave your culture, when you leave your place, you lose your identity, and that sort of leads to a lot of psychological and other social impacts on the people generally. It leads to the breakup of communities, it leads to the loss of cultures, the death of cultures, the death of traditions. So I think when it comes to internally displaced people, I think firstly what we need to do is that we need to temporarily get them settled somewhere.
Right.
But on the other hand, we need to sort of ramp up our climate resilience mechanism so that we could avoid such tragedies in the future, so that we could protect the cultures, we could protect the lands, we could protect the communities. And it's a social issue, so it requires all segments of the society. So come together, let it be public, let it be private, governmental, non-governmental, international, domestic. Everyone should come together, they should join hands. Climate change is here now, and it's not going, and it's going to aggravate every year. So we need climate resilient mechanisms to deal with that in the future as well. And I think rationality has to do with, you know, learning from the past mistakes and sort of learning from them, and then, you know, seeking inspiration and formulating mechanisms to deal with them. So like we were hit very badly with the 2010 floods, and Sindh was devastated, and you know there was a lot of, it took so long for the rehabilitation and relief work, and now Pakistan is amongst the top 10 countries that are climate vulnerable, and it's going to impact Pakistan in the coming years as well.
And climate-induced migration, if I'm to quote some statistics, it does happen as it is. I think hundreds, rather thousands of people in Pakistan are found to migrate every year so as to avoid weather patterns. And then of course there are studies to actually suggest the fact that, you know, by 2050 it is expected that around 2 million climate migrants may be migrating all over Pakistan. So the question then is that, do we have a national rehabilitation plan in place so as to address all these issues?
So that's actually a question that a national rehabilitation program is absent currently, and we need to formulate it. We need to address this issue of refugees, we need to address this issue of displaced people, we need proper mechanisms to rehabilitate them for short term as well as for long term. And I would like to connect it with infrastructure as well, and I would like to give an example of Chittagong, where floods were quite prevalent. So they formulated policies where they developed climate resilient infrastructure, roads, transportation, buildings, everything was built, kept in mind the fact that, you know, floods are here, climate change is here, and we need to tackle that. And now the problem is largely addressed. So we need to seek inspiration from our neighbors as well, and we need to adopt those policies in our countries as well.
Right. Your point is noted, on which I'll come to you, Ali. I think we must also talk about the very pressing issue of course, mental health. And in this regard, we have seen that, you know, people will, of course, suffer from psychological trauma. Some, of course, is imminent, other is something that will surface in time to come. But when we talk about, you know, tackling this issue, more so mental health per se, at the end of the day, how do you feel as a psychologist can we take this issue seriously? Because mental health, as we all understand, is unfortunately an issue which is not taken very seriously in our society.
When we talk about mental health, we think it's a stigma, to be honest. And we try not to talk about it. But climate change is here. And floods are not going anywhere, as we spoke about earlier. This is the need of the hour to talk about it, to tell people how to cope up with devastating things, water everywhere, being displaced. It's not easy. So we need to tell people, okay, this is the thing, this is how you're going to do. We just need to use not psychological terms, but just be there with them. Talk about in local language. Talk about with them, okay, this thing happened, this is how you need to do, not exercises or anything, but just like a local language we talk, like, you know, like friends talk to each other. So be their friend. Counselors need to go there. Like their basic health units, doctors go there. So we counselors also need to go there.
A very important question which then arises, Alia, is that do we have enough counselors? Do we have enough doctors? Do we have enough psychologists? Because my understanding of the healthcare system is, and I think we have done shows on this before as well, that there is a dearth per se of psychologists and psychiatrists in Pakistan per se. So when, of course, calamities like these hit the country, then how can we actually work on manpower? How can we ensure that, you know, every patient there who is possibly suffering from any kind of a psychological illness, they get a proper doctor who gets to treat them?
If you don't have a proper psychologist even, because there is a dearth of psychologists. I mean, we have loads of psychologists, but there are very few who have hands-on experience.
Right.
Because they are fresh graduates even. But there are very few who are working in the field, because you have to go in the field and be with them. So that is exposure. They don't have that exposure, you can say, because it's not easy to go there even. And they are very young people who are practicing.
Right.
So we need to talk about it. Even we need to like use social media. Social media is the most important thing
right
now.
I think that is a very valid point raised by yourself, that, you know, when we talk about it, of course, it's in a way giving those who are suffering some level of comfort. And I think social media can be that one platform which can actually be the driving force between all these conversations. But I think a very important, you must be remembering that, you know, when COVID hit us, I remember in America, in New York more particularly, America said that, you know, considering that we have a dearth of doctors here, a lot of medical students who per se don't have the license, we'll actually allow them to help us treat patients, because of course the very basics of medicines and science they would be able to understand. So maybe perhaps initiatives like these, if in the event that, you know, we have a dearth of doctors, there would be people out there to at least give people a basic level of, you know, medical care. What would your views be on this, Dr. Sobia? How can we deal with these challenges, because these are the issues that are coming up, and these are the issues that will continue to come up?
So absolutely, we have to improvise in situations like this. And where you don't have doctors, you can have, for example, medical students, you can have nurses, you can have nursing students, you can have students from various universities who are psychology students, who are people, who are not exactly degree holders, but who have been working in close liaison with, professionals. They can all go out and they can all work. So I think it's not a big issue at all that we need to have people with huge experience working. You can have people who are attached with doctors, with psychologists, paramedics, who can, I think, all do the job. And
Madam, also lady health workers, because community health again is very important, not only in Pakistan, rather in all parts of the world. So I think this is where the local engagement that comes into play as well.
Of course, lady health workers are very important, because we have to realize that that is a system which already exists in the periphery. So that is a system which is already there. But their assistance can, for example, help in giving birth, help in assessing the psychological and the physical needs of women, etc. So I think we just need to increase our pool of people, and they can take care of people and their demands, not to the best possible degree, but in whatever capacity.
Right, Dr. Saib. And I think in this regard, it's very pertinent to mention the fact that, even during the COVID-19 pandemic, we did see that, all these mental health helplines, they were being established in which people could, of course, reach out to for help. So maybe perhaps we can replicate something, considering that, Pakistan is now very badly hit by this flood catastrophe, on which I'll come to you. I think we must also talk about how, of course, floods will in the long term impact the society, of which a very important part is, of course, the education and the education system of the country, more so education that was being imparted to those who've now been hit by the floods. So in this regard, considering that, of course, schools have been washed away, considering that schools are being used to actually, have on board many displaced families, how precisely do you feel can we then make sure that, education is given to all those children who have been actually deprived of their right to education?
So firstly, I would like to develop this link between education and the progress of any nation. We cannot progress without education, and for Pakistan there is a dire need of educated people to come ahead and contribute to the society, to the progress of the country. Coming to the floods now, floods have sort of devastated all the educational infrastructure that was available in those areas, such as Balochistan or Sindh or KPK.
People have been moved inside schools to give them a safe place.
For rehabilitation purposes. So people have lost access to education. Even children have lost access to primary education. Large chunk of children in Pakistan only get primary education, and now that means that they're not even going to get that.
Right.
So
but it's also pertinent to mention that some very promising initiatives have been taken. We have seen that 10 schools have been set up basically in Umarkot in Sindh, where basically education is being imparted at a basic level there. So I think these are the initiatives which perhaps need to be replicated.
Exactly, and I was coming to that point, and that's quite pleasant to know that the government of Pakistan has been placing immense emphasis on education, and that was one of the points that has been raised at several platforms, that education is being compromised due to all of this flood scenario. So the government has undertaken a lot of initiatives, like recently the HEC has announced scholarships for flood hit people, for graduates and undergraduates, and additionally they have also initiated this program of deferring their academic fee, and then NGOs and non-governmental institutes are also partaking in all of this scenario, such as USAID has announced its program of building schools, and the government of Sindh specifically, I would like to appreciate that they're doing a lot of attempts to ensure that the educational access is not compromised in times of this calamity.
Right, your point is noted, on which I'll come to you, Ali. I think we must also talk about a very glaring issue, which is that of poverty. Now we understand the fact that, of course, people who are poor, people who are already disadvantaged in the society, they are worst hit by it, and this is something that we see in the current catastrophe, so to speak, too. But then again, those who are hit by it, it adds to their burden of course, poverty. So considering that, both poverty and, of course, natural catastrophes like these, like the floods that we have experienced recently, they do, one way or the other go together. How can we work on, addressing both these issues?
We need to accept, first of all, because what we need to do is, like, we keep on talking about it and the catastrophe it has caused, but we don't go on the remedy as such. So we need to focus on the remedy. It has gone now, it has happened. So we need to accept it and we need to build our resilience. That's the most important thing, building resilience. Talking, as I said earlier, talking about it, starting afresh. I mean, it's too early to say that, because they're still settling down.
Right.
And more rains are there expected.
Right.
So it's still too early to talk about it. So, I mean, loads of, like you talk about the society, loads of people are going there even in private capacity and trying to help the people, which is very good, because they need empathy right now.
Right.
And the most important thing is to empathize with them and to let them know that we are all a part of it.
Right.
Which is a
Basically.
good thing.
And
The
I think
government-
a lot would also depend on, of course, maybe perhaps planning too, because a lot of times, you know, there is a school of thought of environmentalists which says that, you know, perhaps those who hadn't built their houses near the river banks, they could, you know, have saved themselves from being victims of the floods. So I think then a lot also goes on the way you plan your housing designs. A lot also goes on the way that, you know, you plan societies, or for that matter households. I think you would have a good narrative on this as an environmentalist, that when we talk about, you know, having sustainable solutions, what are those issues, what are those areas that we need to focus? Is it, you know, having the right infrastructure? Is it having the proper planning? And of course, in this regard, both rural and urban planning, and or is it, you know, having the right policies? What do you feel are the areas which need our most attention?
So I think that firstly you need to focus that we need a comprehensive response to all of that. So we need to address the loopholes that exist in so many domains that collectively impact the people at large. And I think primarily we need to address the institutional barriers. For example, the legal barriers, that there is no proper process of licensing or providing permits for the construction of buildings, for the construction of hotels in these areas. So that's what we see that was prevalent in Swat, where these high class hotels got destructed due to floods because there was no licensing, there was no permitting.
And I think in this regard, it needs to be ensured that, you know, whatever mechanism is used, of course, for industries to work, for businesses to work, it must be done in a way which is, of course, environmental friendly. It doesn't, you know, contribute to environmental pollution.
Other than that, I would like to add that despite the fact that we have very limited resources, we are under an economic crunch, we are under immense debt, we have to pay back the debts, etc. Our economy is at the lowest currently. The government is trying its level best for the relief and rehabilitation work, and for that I would like to appreciate the government, because the programs like Benazir Income Support Program, under which rupees 25,000 are being given to the affectees in Sindh, is like quite applaudable, because when you have meager resources and then you realize that people are under an economic crunch and you want to address them.
Recently, we've also seen that, you know, the digital flood dashboard that has also been introduced, which is again a very promising move, because of course it ensures transparency when it comes to actually, you know, ensuring that, you know, the proceeds, whatever proceeds are given, they are actually utilized for the purpose for which they are given. On which I'll come to you, madam, and to conclude today's show, a very important question which does arise and which did arise during the course of today's conversation is the fact that, you know, when we talk about solutions, why is it so important that these solutions, they need to come from us at a very basic community level? Because we have seen government, you know, doing its bit, which of course it does deserve appreciation. We have seen civil society coming forward. We have seen international aid pouring in. But when it comes to, you know, actually helping people out there, why is it so important that the community also steps forward to do the same?
When dengue came to Punjab in 2011, Sri Lanka helped us out. Their experts came and they gave us an excellent structure, and we followed that, and it worked. So I think first of all we need to find out their experience, because we need to develop a contingency plan. As far as health is concerned, this is something that we need to do ourselves. I think no international organization can help us. We need to pay more attention to our preventative health and to the primary health, and also rural health. That is extremely important. In the absence of a robust rural health care center and local governments, we cannot expect international experience or international agencies to help us. So that is something that we need to develop and build ourselves. We know that healthcare has devolved, but the provinces need to take the lead in this manner and need to develop this. As far as technology is concerned, I think technology transfer can occur at the national level and at the provincial level, where experts can come and they can train people. But I think we ourselves will then have to, go in every nook and corner and do things ourselves. Nobody can really, give us a cookbook as to how to improve things. I think as far as healthcare provision is concerned, one very important thing I need to stress is that we need to make sure that our immunization programs for polio, for example, for COVID, they don't get disrupted in all of this. It's very, very important that the primary immunization program for children doesn't get disrupted. People who are require insulin, people who require life-saving medicines, HIV/AIDS patients who require their HIV/AIDS medicines, they should be treated with utmost priority so that life-saving mechanisms are delivered to these areas, to these camps, and these people can take their medicines in order to survive.
That's very rightly put by yourself, madam, and I was seeing this report in which, we saw the fact very clearly that, these polio workers in Punjab, they were swimming through waters to actually reach people in flood-hit areas. So I think we need to have that morale. We need to, of course, I think that's very rightly put by yourself. This is an issue that was also raised during the COVID-19 time when the pandemic hit us, that, during the course of treating the pandemic per se, we must not ignore other health issues, other health diseases. So I think that is something that which is very validly put by yourself. But coming towards the conclusion of the show, what would your concluding comments be, especially when it comes to the very pivotal role of media? What role can media play in this regard, especially when it comes to a conflict, reporting on conflict disaster management, so to speak? How can media report responsibly? How can it do so in an informative manner, and more so looking at the whole calamity in a more positive solution oriented manner, rather than just gloating on the misery of people who have actually suffered because of this catastrophe?
Media has to play a balanced role. It needs to show the positive side and the negative side, but usually media shows the negative side more. But there are some media, like you are doing an awareness program, which is really good. So I think that media needs to go and do awareness program. We need to talk about it, and we need to tell that what are the solutions also that we have been
generally has been very geared on covering the flood transmissions, which of course is very important, because people need to understand, not only the plight of people, they also need to understand that, how can they help them.
Another thing, social media is also very important nowadays, because you see, it's like everybody has a mobile and everybody has net. People are glued to their mobile, so they see the social media more, and it has a more impact. So we need to provide awareness to people through different programs, like we are talking about it. We are talking about the solutions. So we need to give them solutions. We need to tell people how to approach them, how to help them. And the most thing is that these natural disasters are not going anywhere. They are here to stay. So we need to train them mentally that, okay, when a disaster comes, how to respond to the disaster, how to act, how to take care of your physical, mental health of your loved ones. We need to teach the women, the children, their rights.
And
also how to address them.
Reach out to those who need your help, of course.
And the social media can do that. Because it's in every household, and it's the need of the hour. So the more we talk about it, the more program. We don't need to do any specific program, just mere talking about it, telling people, engaging the community.
Engaging the community. This is exactly what I want to focus on. In this regard, I would want you to also comment, before we conclude today's show, that, what role can young people like yourself play, especially when it comes to giving back to the society, when it comes to, of course, conflict disaster management, when it comes to changing your own lifestyle, which could possibly be, be leading towards environmental pollution and in the long run, climate change too, because, considering that this is a calamity which has hit the nation, which by and large will affect the Pakistani society at large, the solutions per se must come from the society too.
Exactly, Fatma. Youth of Pakistan holds immense potential, and they can be key to to sort of solving all the climate induced issues that Pakistan has to face today. Let it be in the research domain, let it be in the academic domain, let it be in the economic or in the climate resilient mechanisms domain, let it be in the relief and rehabilitation domain, let it be the volunteer work that they're performing currently under the governmental and non-governmental organizations. They're providing them with blood and also the relief work. They're providing them with aid and assistance. They're sort of bridging that gap between the people who need to provide and people who need assistance. So they sort of link both of them up because they're efficient. They can add to the efficiency of the system. They can bring in new modern ways.
What do you feel are the most important steps that we as a nation, we as a society needs to take, especially when it comes to not only mitigating but also adapting to climate change, which of course is being attributed to such catastrophic floods that we have recently experienced? And number two, what are the preventive measures that we need to take in this regard?
We need to adopt policies. So before we go to the post-disaster scenario, we need to focus on the pre-disaster scenario. And on that, I would like to stress on the importance of the availability of climate monitoring systems. We don't have proper climate monitoring systems, so that we cannot predict as to at what potential the disaster is coming. Like we couldn't exactly
we need
navigate.
to have those early warning signs.
Exactly, early warning systems like the ones that we have, the ones that are available abroad and the ones that we have in Islamabad that were established in the post-2010 floods. We need warning systems like that in provinces like Balochistan, KP and Sindh as well, that we know are vulnerable to climate change and are going to face these impacts in the near future with even more frequency.
And I think we really need to make our infrastructure more climate resilient.
Exactly.
That is also the need of the hour.
Exactly. And other than that, if we look at the solution in the long term, it's a high need of the hour that we need to focus on virtual connectivity so that the economy is not compromised, so that the education is not compromised.
And I think this is something that we have been doing in the COVID-19 pandemic as well, so perhaps we can replicate that here as well to the extent that it can be replicated. On that note, thank you so much Alia, thank you so much Yameen, and thank you so much Dr. Sobia for being here with us today. Well, to conclude today's show, we generally spoke about not only the social but also the psychological impact of these catastrophic floods that we have witnessed as a nation recently. In this regard, it is very important to not only talk about short-term but also to talk about long-term solutions. A very important thing that we need to do in this regard is to keep on talking about these issues, because the more we talk about them, the more we sensitize people. And in this regard, I feel the media more particularly has a very important responsibility. It has the responsibility to report that too very objectively, that too of course very responsibly, and that too in a manner which is solution oriented. On that note, signing off for today. Until next time, take care and Allah Hafiz.